I first started to notice a change in my vision probably around the time when I turned 50.
I couldn't read a phone book, read the newspaper, read a text message on my mobile phone, couldn't read any of that, so I had to have glasses around me all the time, which I constantly lost and misplaced and broke, and yeah, it's all a bit ordinary.
Presbyopia is an ageing process of the eye. As we get older, we lose our ability to see things up close. And everyone gets presbyopia. It's universal, it's just part of getting older. Perhaps one way to think about it is to talk about a camera. So if you have a camera with a focusing ring on it, you can have the camera in focus for something, and then you can turn that focusing ring and change the focus. So it goes from being for the distance to being in focus for things up close. As we get older, our focusing ring can move less and less until by the time we're 60, well, the eye's in focus for something, but it can no longer change that focus. That's presbyopia.
But just imagine if your eyes could adjust again as easily as a camera lens, so you could read the newspaper without having to wear reading glasses, or be able to easily read text messages on your mobile phone without having to reach for your glasses, or be able to read the price tag when you're out shopping. Well, that's all possible with the new corneal inlay called Kamra, and it's now available in Australia.
This animation helps to explain how the Kamra device works, and you can see that we're using a laser, a femtosecond laser, to create a space in the cornea, and we place the Kamra device into this space and it sits there. So this thing's so small, you can see it on the tip of my finger, and it's thinner than a red blood cell. It weighs less than a grain of salt. It's quite amazing what a difference it can make to your vision. We've had a number of treatments for presbyopia we've been using for 20 years. But what Kamra offers us is a treatment that is specific for presbyopia. It's not designed to change the focusing of the eye, so it's not specifically for people who are short or long-sighted. It's for people who have normal vision, but as they get older, lose their ability to see things up close.
I was very surprised that it was only one eye. One of the questions we asked at the information evening is, when do they do the other eye? And they explained that they never do because the brain retrains both eyes to refocus, which is quite amazing.
A slight discomfort during the procedure, but no pain, and out in maybe 15-20 minutes.
By the next morning when they wake up, the eye will feel pretty normal, and they'll already notice that their close vision is improved.
Pretty well perfect improvement within days.
Very happy.
Absolutely.
Very happy, yeah. It's been well worth it. The majority of the time we both don't need to grab glasses if we're doing something or need to suddenly read something, so it works really well.
I'm very happy to have Kamra now as part of the procedures I can offer to my patients. We've needed something for a long time that works well for presbyopia, and I think it's going to offer my patients a great opportunity to get a good outcome with their treatments for presbyopia, and I'm pretty excited to be part of this.